Questions. Thanks, Kevin. As inversion intensifies along the Wasatch Front, doctors are getting more calls from patients with breathing problems. News specialist Boal is live out in the bad air tonight with 5 ideas from Intermountain Medical Center that just might help. Jed?
Well, listen to this, Dave. If you live in northern Utah, you don't even have to go to the theater this weekend to see the desolation of smog because it's all around us. The air is listed as unhealthy in Davis, Weber, and Utah counties, and it's not getting any better.
It's just shocking when you look at it and you can actually see the particulates in the air.
When Dr. Denitza Blagev flew into Salt Lake City for a job interview 3 years ago, pollution shrouded the valley.
When we came back and the air was clear, I said, oh, there are lots of mountains around that we weren't able to see when we came.
Now, the pulmonologist helps patients most sensitive to the pollution.
There are so many people that are suffering from it.
People with underlying lung or heart disease, the very young and the very old.
We're breathing it and it's terrible for us.
Here's how you can protect yourself. Take your medications and use your inhalers if you suffer lung disease. Stay indoors.
Try and avoid breathing the air, which seems crazy, and the best way to do that is really to stay indoors.
One of the simplest ways to avoid all of that pollution is to escape to the mountains. Go for a hike. Go skiing if you can. But keep in mind, you do not want to exercise or overexert yourself in that cloud of smog.
Bad air days are not the days to go out jogging outside or biking.
We should also try to limit emissions from our cars.
Most of what we're breathing is the exhaust that comes out of our cars.
When the pollution particles get in our lungs, any of us can feel chest tightening, throat irritation, and eye watering.
If you're breathing stuff that you can see, that's not good for your lungs.
Dr. Blagev points out that we all respond to that pollution differently, but we are all exposed to it, and that exposure alone puts us all at a higher risk for lung and heart disease. So try to limit the exposure to this bad air, and let's hope that a storm clears it out soon.
Holding our breath is not an option, is it, Jed? Thank you.